mental illness affecting the workplace culture. So we'll go ahead and start by introducing the rest of our team. Jody, would you like to introduce yourself?
Hi, my name is Jody Patchen. I am the admin to the ECHO project.
Thank you, Jody. And Jessica.
Hi, I'm Jessica Reiswig. I work for the ECHO project at Minot State University.
Awesome. And finally, Linda.
Hi, I'm Linda Anderson. I work at the University of Minnesota, and we're happy to be working with the ECHO project. And I saw some Minnesota people in the chat, so that's great. I do work related to DSPs and family supports, and used to be a DSP myself.
Thank you, Linda. We're so excited about this partnership. And Jen, since you're on, would you like to unmute and introduce yourself?
Yes, I sure will. Good morning, everyone. I'm Jennifer Hall-Landy. I am also with the UCED, which stands for University Center for Excellence in Developmental Disabilities at the University of Minnesota. I work with Linda, and we do a lot of work in the developmental disability sphere, but we do also a lot on supporting the direct support professional workforce, supporting health and wellness within that workforce. I'm also a former DSP and job coach, so I'm just happy to be here.
Thanks, Jen. We also want to give a shout out to our DSP subject matter experts who helped us develop this training very early on, and they shared a lot of their insight on what they're experiencing in the field, which helped us narrow down our topic areas so that it was the most relevant. So we greatly appreciate their input, and anyone on the call that helps support those DSPs to attend those meetings. We know that with the turnover rates and the workforce shortage that we're facing, that was not easy. So we really, really appreciate you making that happen, because it was definitely invaluable. So I would like to introduce our speaker for today, Allissa Torres from Mental Health America. Allissa is the Director of Mental Health Equity at Mental Health America. Her role ensures that MHA centers equity in every part of its work. Allissa spearheads projects such as the BIPOC Mental Health Month campaign in July and advises on many other campaigns throughout the year. Allissa has over 10 years of experience working with mental health nonprofits on local, regional, and national levels. She holds 2 degrees, a Master of Social Work from the University of Southern California and a Bachelor of Arts in Psychology from Arizona State University. She's passionate about all things equity and especially is interested in the intersection of social justice and mental health. She's a firm believer in community-centered care, grassroots advocacy, and liberation-based practice. Alyssa's lived experiences as a Latina woman with mental health diagnosis drives much of her passion in this field. Thank you so much, and please help me in welcoming Allissa.
Hello, everyone. Thank you so much for that introduction, Krista. I'm going to try to share my screen, and if I could just have somebody confirm once they're able to see it. Is everyone able to see that? Okay, perfect. And for some reason, I think you're also seeing all of my million tabs that are open. So apologies for that. I don't know why it's not letting me open just the presentation. But hello and welcome. My name is Allissa Torres, as Krista mentioned. My pronouns are she and her, or ella if you speak Spanish. I'm the Director of Mental Health Equity for Mental Health America's National Office. And as a visual description, I am a brown-skinned, feminine-presenting Latina woman with my hair in a bun, and I am wearing a floral top. And I'm here today to tell you all a bit more about our work at Mental Health America and show you some ways that you can better support individuals seeking accommodations within the workplace and also students as well. And so I'll be highlighting a few different things throughout this presentation. So I want to start us off with just some of the key objectives to help you all follow along. And so in addition, I also want to let you all know that I'll share these slides after the presentation, and I will verbally cover anything on the slides. So please do not stress too hard about keeping up with anything on the slides, specifically with a lot of text. I know that can be tough sometimes for folks. And also, as Krista mentioned, I do invite you all to keep your cameras on or off, depending on what is comfortable for you. And feel free to engage in the chat or use the hand raising emoji to ask questions. And anything that doesn't get covered in this presentation or any follow-up questions can be shared if we have time at the end, or you can feel free to share them with me via email, which I will also share with you at the end of this presentation. So on these objectives, first, I want to introduce you all to Mental Health America and what we have to offer. I also will cover the ways that that you can support individuals with mental health diagnoses. In addition, I will cover the ways, I will also be sharing ways to create an overall inclusive environment. And I will also be sharing concrete examples and resources for how you can continue this work in the way that works best for you and your employees. So start along with MHA's background. So just to start, like I said, for those of you who aren't familiar with Mental Health America, we also call it MHA, so you'll hear me call it MHA throughout this presentation. We are the leading mental health nonprofit in the United States. As an org, we focus on policy, public education, and service within federal, state, and local levels. We are actually the oldest mental health organization in all of the US, possibly in the world. I don't fact check me on that though. But we've been around for over 100 years. We were the very first. And so for us, we really started this entire conversation around mental health and what that means to be mentally healthy and what it means to experience mental health in a non incarcerated way, because at that time that we were created, our founder actually was an individual who had been incarcerated due to mental health issues, or mental health conditions, excuse me. We also have affiliates in most major cities. We have about 145 throughout the nation. And those affiliates focus on these areas and additionally provide direct service and outreach to those in their region. And in addition to that, we provide free mental health screenings, resources, and calls to action on our website. So one of the things that sets MHA apart from other orgs is that we see mental health as a critical part of wellness. And we seek to integrate equity and the expertise of those with lived experience into every aspect of our work. In addition to that, our main focus as an organization is prevention and early intervention. So that's what some of these infographics here get into. It's vital that individuals know what mental wellness looks and feels like, and that they are aware of what healthy means to them specifically. At the first signs of change in behavior, thoughts, or feelings, we really want folks to know exactly what they should be looking for. So one of the best ways that anyone can do that is to look at our website, mhascreening.org, to take a free mental health test. These are the same tests that you would take if you were to go to a doctor and express a need for a mental health screening as well. And on there, you can find various evidence-based screenings, which are, like I said, the same that doctors typically use as well. And ideally, individuals can go to our site, take a test, and use the results to help them find support for next steps. So ultimately, our goal is simple. We want people to feel good and to know where to go and what to do if they aren't feeling great. And we want individuals to understand that mental health exists across the lifespan and that it is not just points of crisis that we want folks to focus in on. So as we see here, this is our before stage 4 philosophy. It's focused on prevention, early identification and intervention, integrated services and care, and recovery. So before I get into anything more, I want to start us off with looking at the medical model of disability and the social model of disability. Hopefully most of you are already familiar with this, so I'll just highlight it briefly. The first model we see here is the medical model. Oh, excuse me, I just lost my page. One moment. There we go. Okay. So essentially, what this first medical model of disability is what we typically see as the societal understanding of what disability is. Essentially, it views disability as resulting from an individual person's physical or mental limitations and not connected at all to the society, the social or geographic environments. And mental health diagnoses typically indicate that somebody is experiencing distress. Mental health conditions can be considered disabilities when they substantially impacted a person's ability to meaningfully participate in the world around them. So with the second model here, the social model of disability, disability is not a result of this person's difference toward others around them. What it is instead is it results from barriers in a person's environment. So what's considered a disability is often a reflection of whose needs are normalized. So as you learn more in this presentation, and as you continue on a path toward providing more supportive services to those around you, I'd like you all to just consider the social model as a way to challenge the normalized medical model of disability, and ensure that we are being as inclusive as possible with any individual that crosses our paths. So before I get any further in this, I want to start with some of the barriers that are seen when folks attempt to access services or accommodations, whether that's in the workplace or whether that's in school. So I can speak all day on what those barriers are and what I have heard from others, but ultimately you all are the experts. You all are the ones that are in this field, that are working with one another, that are working with individuals. So I'd like to open this up to all of you, and feel free to either jump in the chat to answer, or use the hand raising feature on here to let me know that you'd like to share verbally. If there is anybody raising their hand with the hand raising feature, Krista, do you mind just pointing them out so that they can talk, just because I don't think I can see them from my end. So here, like I said, just what are some barriers that come up for folks when seeking accommodations? And again, this can be in the workplace, or this can be, so as in this could be employees, employers, and this could also be individuals that you are working with through the services that you are providing. So I see Jody says time, money, and transportation. Yes, absolutely. I think this is Krista. Lack of mental health providers, long wait lists. Absolutely. Communication and access to resources. Yes, this is a huge one as well. And fear of repercussions due to stigma. Yes, thank you. That one in particular can affect folks from various cultures, from various backgrounds and experiences that might not have the same understanding as other individuals. So that's really important to recognize how stigma plays a role in whether or not individuals are willing to seek accommodations, or whether or not individuals are even willing to be open about their needs. Communication, embarrassment is also mentioned. Resources and workforce shortages in the field. Yes, absolutely. That could be a huge one, especially when working in this service industry. And working with other individuals. That can play a huge role in burnout. That can play a huge role in feelings of guilt and understanding exactly what we want to give ourselves a break on. Because a lot of times, as somebody who's worked in the nonprofit industry my whole life, I can definitely empathize with that, and empathize with the fact that there comes a certain level of guilt sometimes when seeking accommodations or seeking a break, because you understand that people rely on you. And that can be really hard for many folks. Not realizing that they can ask for and receive accommodations as well. Fear, lack of insurance coverage for private services who specialize in certain areas specific to the individual with disability. Yes, and Krista, you mentioned the feelings of guilt are real. Yeah, absolutely, absolutely. So some of these things I already have mentioned here. So one of the barriers I think that was mentioned already in the chat is just unclear potential accommodations. So a lot of times what tends to happen is that individuals with mental health diagnoses don't really know that they can seek accommodations. and don't really know what those accommodations might look like to them, especially if this is not part of the normal conversation. We don't have a way for individuals to normalize the process of this. So along with that comes uncertainty about the process of asking for help, about the process of having these open conversations with your boss or your coworkers, or again, seeking accommodations. And it can be a pretty complicated application process for folks. When seeking accommodations, you know, there's a lot that comes to mind, such as doctor's notes and having to have plenty of documentation. That's a lot for folks, and especially depending on financial ability, and physical ability, and even mental capacity, that can be a lot for folks. And so breaking down those specific barriers in the application process and in those initial conversations can be a huge help into making the environment much more inclusive. In addition, feelings of shame and fear, as we mentioned before, also feelings of embarrassment or guilt, uncertainty, all kinds of feelings can really come up throughout these kinds of processes. And knowledge of disability in many workplaces and in many services tends to come primarily from non-disabled persons. And the issue with that is that if all of the information and all of the policies are coming from individuals who have not necessarily been affected by policies like these, who have not necessarily attempted to go through processes like these, then there will always be something missing. So it's really important to always center the lived experience of individuals, whether that's with individuals with disabilities, whether that's individuals of various cultures, of various identities. All of that is really, really important in ensuring an inclusive model for workplace and for services. And then in addition, staff lacking knowledge on specific diagnoses and accommodations. One thing that we see often is that individuals may go to their employer or go to a service to seek accommodations for mental health disorders. And the issue comes up that the individual that they're seeking accommodations from is not familiar with that and may deny their need for accommodations, and may deny specific types of accommodations due to that. And in addition to that, there comes a lot of vulnerability, and there comes a lot of really shame that can come from that. If you are going, hey, I finally took this big step to ask somebody for help, to have this conversation with somebody, to ask somebody for accommodations that could completely make my life better, then it can be really, really painful to have that reaction after that whole long process that goes, hey, you don't qualify for this. Your mental health is not a proper disability. So things like that are really, really vital that we recognize. Supporting individuals with mental health conditions. And again, this is applicable to whether in the workplace or within the services that you are providing to others. So now that we've talked about the barriers that individuals face, I really want to give you some ways to combat those. So starting with just some ways that mental health affects individuals who are seeking service. So for example, inflexibility of deadlines and attendance policies can make class or work really inaccessible for individuals with depression. This can also occur for a variety of other diagnoses and conditions. However, I'm just noting depression here as an example. And so maybe their depression doesn't affect their work quality, but it can really affect how they're feeling throughout that process. It can really affect that ultimate feeling of burnout, that ultimate feeling of feeling included, feeling welcome, feeling comfortable in your environment. So it's really vital to recognize how much deadlines can and attendance policies can really play a role in that. In addition, a lot of times we are just as we're doing now, virtual class or work attendance can be very helpful. But if there is no recordings of that for people, for example, with auditory processing disorder, or even people with anxiety, it can be really difficult to pay attention to the whole piece of information. And even down to individuals with physical disabilities, it can be difficult to, be taking notes on information, be taking, having full attention paid to the information that's given to you without the ability to go back and review that later. So things like having more flexible attendance policies, more flexible deadlines, and offering recordings can be very helpful. As we mentioned in this session as well, it can be really helpful to offer the option of either keeping your camera off or on and engaging verbally or through chat. There's a variety of different ways that individuals can communicate, and there's a variety of different ways that individuals learn. And it is completely vital that we offer many options so that individuals can choose that for themselves. And in addition, individuals seeking accommodations, whether that's in higher education or in their work, really have to rely on existing definitions of disability. That's where we get back into that medical model deficit of disability. And they have to rely on self-advocacy. And especially if you are somebody who might be in the depths of depression, dealing with trying to get accommodations, maybe getting rejected here and there, maybe having a boss that invalidates you or coworkers that don't fully understand your need for accommodations. It can be extremely exhausting to also have to self-advocate on top of all of that. So it's really important to try to incorporate these kinds of accessibility options early on, rather than waiting for individuals to actually reach out and ask for them, and also providing flexible options as well for individuals. So there are several key considerations to keep in mind when working specifically with BIPOC individuals and other individuals with intersectional identities. And I want to acknowledge that much of this also applies to other groups beyond BIPOC individuals. And for those of you that don't know, BIPOC stands for Black, Indigenous, and People of Color. So essentially, it takes over the term of people of color that we've used in the past, but this specific term just acknowledges that in the U.S. specifically, and typically throughout the world, Black and Indigenous individuals tend to have the highest rates of oppression. And so that's why I'm specifically calling out these individuals. But again, these barriers and recommendations can apply to a variety of identities, such as LGBTQ, such as a variety of diagnoses and disabilities as well. So going back to barriers here, there are several key ones that we need to acknowledge in order to understand how to move forward and how to be better. So as I mentioned before, understanding of formal processes, such as understanding how to get accommodations or seeking support, can be a major issue. Many folks with mental health conditions don't know that they can be considered disabled, don't know that they might qualify for accommodations. And depending on somebody's culture as well, they might not even be aware of what of the fact that they're experiencing a mental health condition. For a lot of cultures, for example, for Latino cultures or Latina or Latinx cultures, there is typically a show of physical symptoms and an acknowledgement of physical symptoms long before there is an acknowledgement of the actual mental health condition itself. So sometimes, that can come to, sometimes an example of that might look like in the workplace, it might look like somebody saying, oh, I've just been really tired lately, or oh, I just haven't been feeling myself. I just haven't been feeling right lately, or oh, I just haven't been getting my work done lately. I've been having aches and pains. Things like that can really, or mental health conditions can really show up somatically for individuals. So it's really important to recognize just how much that can affect individuals. And in addition, recognizing the financial, educational, emotional, and access barriers that play a huge role in whether or not somebody is having these conversations about their mental health and well-being, and having these conversations about potential accommodations. It is also very common for individuals to lack the means of getting to a doctor. Like I mentioned, doctor's notes can be a very, very large barrier to help. For me personally, doctor's notes are a pet peeve of mine. I cannot stand when people are only allowing a doctor's note to be the only way to have any information. So one way that comes about typically is that's in a policy that might be in the employee handbook, that says that, hey, your supervisor will require a doctor's note if you're requesting any extra days off or any other types of accommodations. So getting that access barrier out of the way early on can be a huge help to your employees. And specifically, representation can also be a large barrier. It's really important that individuals see themselves represented in those around them. And so culturally and linguistically, it's absolutely vital that individuals have others that they can look to in order to feel connected and understood. Oops, excuse me. As I mentioned, lack of cultural understanding really can be problematic, and shame, fear, and distrust come with that as well. So some recommendations here. We want to center lived experience at all times, if possible. So that means specifically asking for the input of individuals. If you have an ERG, an employee resource group, that can be something that individuals have an area to experience other individuals with similar experiences. And that can also be a way, if the ERG is willing and interested already, that can be a way to center lived experience, or know who might be able to assist with lived experience expertise. Again, with that, I also want to acknowledge that ERGs are meant to be a safe space for individuals. They are not meant to be a way for individuals to assist their work. It's actually a way for the work to assist the individual. So if there is any input from ERGs, that needs to come from a very person-centered and identity-centered way, and that needs to come with complete consent from the individuals there. And I want to invite you all to really take on a culturally humble and responsive approach, and not a culturally competent perspective. And what I mean by that is that a lot of times, I think for several years, there's been this conversation about what it means to be culturally competent. And cultural competency can mean, having all the information that is needed to support the individual in front of you. And that can be really hard, because that focuses on our need for researching this information, for having all of the information that's out there. And it also gives us it essentially gives us a goal point, where you can also be the expert. And I want to acknowledge that regardless of the information that is out there on other cultures, on other identities, there is no way for you to be 100% culturally competent for every single person that comes across your path. So a way to do that is to be culturally humble, to be aware of the information that's out there, to be intentional about finding that information, and to be responsive to that information, but recognizing that this is a lifetime learning opportunity for you. For every single person, we have to have an open mind. We have to understand that you're never going to be perfect. I am an equity expert, and I will never be perfect, and I will always seek to find feedback from individuals with lived experience and individuals that are actually within the communities that I'm reaching out to. Sometimes that means that I have to pull in extra consultants. A lot of times that means that there's a lot of extra money that has to come through, which is very hard to come by, as many of us know. So it really takes a lot of advocating on behalf of the individuals that you're serving. And also recognize that individuals and communities are not monoliths. They are not all the same. Not every Asian community is affected the same way. Not every Latina community has the same background, has the same language, has the same dialect. So it's really vital that when seeking information, you're not making generalizations. If you are going to talk about groups of individuals, seek to be as specific as possible. So one way that we did this at Mental Health America is that we are in the process right now of expanding our cultural hubs. We're getting away from this idea of what BIPOC is. I personally am not even a fan of BIPOC, the word itself, not the people. Obviously, I'm one of them. but I'm not a fan of using these generalizations. It's not helpful because we know that we're not monoliths. We know that individuals are not the same, that even individuals from the exact same family, from the exact same upbringing, could be a year apart, have very, very different experiences in what their identity means to them. So it's really important that we recognize that and that we're implementing ways to be specific. And in addition, recruit and implement sustainability practices for diverse staff. And so that means getting out of our comfort zone when recruiting staff. That means going into spaces, putting our recruitment information into spaces that might not necessarily be the norm for your organization. That means being specific about the fact that maybe you want to promote job opportunities in, for example, a Latinx conference. That's where I just was a couple days ago, so that's fresh on my mind. But it's really important that there are a variety of places that you are pulling staff from, rather than just having a couple main areas that you are doing that. So I highly recommend that when recruiting staff and when maintaining staff as well, that those are key factors that you're incorporating. In addition, having consistent trainings. Like I said, it's vital that we are recognizing everything that we do as lifelong learning opportunities. You won't be an expert. I hate to say it. I don't like not being an expert. I love being Miss Perfect over here, but I won't be. And unfortunately, you won't be either. So have trainings that are consistent and have actionable content. If you are continuing to put out trainings that are having you and your staff go, okay, we're listening and learning, well, at some point, you're just going to listen and learn. It goes in one ear, out the other. And you're really not getting to the action that is needed to make an inclusive environment. So make sure that there are consistent trainings and that those consistent trainings include actionable and concrete ways to apply that. And again, create education on how to access disability services and other accommodations, and promote in spaces where other BIPOC individuals are. So that's pretty self-explanatory, as I mentioned that before as well. And so there are some ways that we can support individuals with inclusion in mind as well. And a lot of this comes from really challenging the status quo. So we want to examine current structures and ask questions. We want to hold organizations and institutions accountable. Sometimes that means speaking up in an uncomfortable meeting and saying, hey, this doesn't feel right, or hey, who was at the table for this? Because that doesn't feel like it had everybody who was needed at the table when this policy was created. You want to push for accessibility in traditional healthcare and other service practices as well. So one way that I do that in my work is that I am always trying to be aware of what information is out there, of what other individuals and organizations are doing, but also ensuring that I'm asking the right questions when I am working, of just always having the mindset of, okay, what could possibly be missing in this? Is there any possible way that I might misunderstand this information? And what does that look like? And what would I need in that situation? And in addition to that, whenever including any kind of healing practices, any kind of wellness practices, and even research, it's really vital to give credit to the originating communities. A lot of times what we see, especially that happens in workplaces, we see this idea of like a restorative justice circle that can happen. For those of you that aren't super familiar, basically that can include intense discussions that can happen at work, and a lot of times that tends to not credit the groups that started those kinds of practices, which are typically indigenous groups. So when incorporating any kind of wellness practice, things like yoga as well, it's important to acknowledge that is not something that just showed up in Los Angeles one day that everybody suddenly loves. That is something that's been around for thousands and thousands of years. And it's really vital that we are always giving that credit to those originating communities. So some more recommendations. This website I have here, so mhanational.org is our main website. You can find tons of information on it. But mhanational.org/college report. We had put out a large report last year that stated how college students, how mental health of college students intersects with the use of disability services. So it highlighted many of the barriers that students with mental health conditions face when accessing disability services. And this can really apply to the workplace as well as the service that you're providing for students. So some of the recommendations that we came about with, given the information that we received during this report, was to partner with students who are to educate the campus community on mental health disabilities and accommodations. In the workplace, that looks like also including the expertise of lived experience early on, and not expecting that of others who have lived experience, but rather offering open-ended opportunities for individuals to always provide their input if and when they would like to. And celebrate and educate students on disability cultures and contributions through courses in disability studies and at disability cultural centers. Again, applying this to work as well, really ensuring that all identities are celebrated and that there is a normalization of the various identities that are out there, and not just a focus on one particular identity that we are making assumptions of that may or may not affect other people, may or may not affect the majority of people. In addition, partner with individuals with disabilities to train disability services staff to understand and develop appropriate accommodations. Again, in the workplace, this means centering lived experience. I'm going to say it again until my face goes blue, but we really need to center the expertise of lived experience. At Mental Health America, we are the leading mental health organization in the US. We have an extremely large reach, and we pay those with lived experience expertise exactly the same as we pay individuals who have high level years of experience, high level education. So we recognize that expertise does not have to look like a million degrees. It really can look like an individual who's gone, hey, I've lived with myself for my whole life, and I know what people like me need, and I know what people like me have experienced. So partnering with individuals with lived experience to train staff and to train and to develop appropriate accommodations is really important here. In addition, providing navigation support during accommodation processes. So making it very transparent of what accommodations could look like, of who might need accommodations or who might want accommodations, and putting information out there that is very specific and step-by-step of what is needed, and of what barriers they might come across and how to overcome those barriers. And so again, a lot of those barriers can be overcome through having flexible policies in early on. But it's important to always have that information out there, because odds are, you know, you give people an employee handbook early on and they read it once, and down the line you have to go, oh, I don't even remember where I accessed that employee handbook. So it's really important that we provide these navigations in a transparent and in a transparent way. Like I mentioned, creating alternatives for medical documentation of mental health disabilities and other disabilities as well. Because again, lack of health insurance, lack of funds, lack of transportation can be a huge issue. And frankly, even if you do have all of those things, it can still be really difficult. I often think about my days in previous organizations and even back when I was in grad school, and how difficult it was for me to go find a doctor's appointment, because either it took a long time or I knew that my condition required excessive testing or things like that, and that can be really expensive. I had great medical insurance and that was still too expensive for me. And so even with all of these ways to access care, it can still be a huge barrier to require medical documentation. And then train professors and employers and employees on mental health disabilities and accommodations, including how to support individuals requesting accommodations. And so these are some of our resources as well. So one of the best parts of Mental Health America's work is that we are always looking to equip the public with tools to apply the information that they need to support the mental health of various communities. So throughout every year, you can find MHA releasing toolkits with information such as sample social media posts to spread awareness and action, informational fact sheets, worksheets, resources, both from MHA and from other organizations. We also put out a lot of webinars as well. And we do like releasing our toolkits on commemorative dates, but you know, we absolutely don't let that be the extent of our work. Of course, mental health matters every part of the year, and we want folks to use these tools beyond just the times that they are released. And while we have several toolkits, and I definitely encourage you all to check out our website and you can just type in toolkit in the search bar. There are three that I really want to highlight here that I feel could be extremely helpful for you. So in May, every May, we celebrate Mental Health Awareness Month. So in May of this year, we released a toolkit on what we call Back to Basics. And it offers easy to understand tools and shares several fact sheets that highlight the basics of mental health. And this toolkit is also available in Spanish as well. And it can be accessed on the web link that I have posted under this first image. And more recently, we released our Workplace Mental Health Toolkit that actually was just released last week, so just in time for this. It really assists employees and employers in creating and sustaining cultures of support and well-being in the workplace. What I would really like you all to remember is that a healthy service is only as healthy as the individuals in the organization itself. So to create and maintain supportive services, you must be willing to apply this information to not just your students and clients, but also to your staff and to yourself as well. We simply cannot do the work that we need to do, especially when we're working with high needs of others. We cannot do that work if we are burnt out ourselves. So we need to be able to offer inclusive environments and wellness practices early on and often in order to do that. So this toolkit is absolutely fantastic, this one in the middle. And I encourage you all to check it out. It's mhanational.org/workplace. And then our third toolkit, this one in particular was my project for the year. is our BIPOC Mental Health Month toolkit. So in July, we released that. As I mentioned, we released toolkits in most commemorative months. But we released this one, and it's also available in Spanish as well, with a theme of beyond the numbers, really getting away from generalizations, getting away from these statistics of disparities, and focusing in on the specifics. And what I did essentially is break up this term of BIPOC into 6 different cultural categories. And I shared specific culture-specific calls to action, resources, and education that anyone can apply for the betterment of BIPOC mental health. So definitely be sure to check all of these out and get more information, including handouts that you could share with your colleagues, and the individuals that you are serving. And finally, just thank you everyone for taking the time to listen to this and to participate. Feel free to follow Mental Health America on social media. This is all of our information as well. And if you have any follow-up questions that we don't get to cover today, please email me. This is my email below. It's atorres, Torres, @mhanational.org. So not sure if we have time for questions, Krista, but I'll let you take it from here.
Thank you so much, Allissa. That was really fantastic. Unfortunately, we don't have time for questions because we still want to get to our case study presentation. So what we'll do is we'll, Allissa, maybe if we can stay on the call after this just to answer those, and then we'll include those in the resources that we'll send out right after.
Yeah.
So thank you so much. That was, I honestly got lost in time because I was writing notes and everything. So thank you so much for presenting and your candor on all of this. I know some of these topics aren't easy to talk about because, you know, it takes some vulnerability to bring it up. So just really appreciate your candor with all of it. Okay, so today we have a case presentation coming from North Dakota, and I wanted to bring up the fact that I don't think we communicated this our last session, but these case presentations are typically based off of employees that have been in the field for a while, that are like well liked by the people that they're working with, and just top-notch employees that are kind of starting to struggle a little bit. So just want to keep that in mind as we're reading through these, because there are some cases where people justifiably need to be let go of if they are not a good fit for the agency. But we've asked for people to provide us people that just have done a solid job this far. So just keeping that in mind when we're thinking about resources and strategies to use with them.